Brooklyn Independent Television.
It's no secret that the best way to avoid having to go through cancer treatment is to not avoid cancer screening. New York State's Department of Health wants to make it easier for Brooklynites to get screened by funding a program at SUNY Downstate Medical Center that focuses on breast, cervical, and colorectal cancers. Here to tell us why it's so important to get screened early and what their program offers are Maria Yomtov, Director of Community Outreach and Principal Investigator for the initiative, and Isabel Rodgriguez, Cancer Prevention Coordinator. Thank you both for being here today. So could you start by just telling us how important these three conditions are that make screening so important?
Well, it is very important because they are the second leading cause of death in colorectal in women and men, and it's third leading cause of death in women.
Breast cancer.
Breast cancer.
So it really is important. And what about cervical? I mean, I know that cervical cancer is not as common as it once was, but it is still a major, it affects women in a major way.
And that's why early detection and screening is so important, because they are treatable and curable.
That's right. So tell me a little bit about your program for the screening.
Okay, so the program is called the Cancer Services Program of Central Brooklyn, and it screens for breast cancer, cervical cancer, and colorectal cancer. So the screenings that we offer for breast cancer include the clinical breast exam and mammography. For cervical cancer, it includes a pelvic exam, Pap test, and for colon cancer, we actually do a take-home stool-based test.
How easy is that test to apply yourself? Because, you know, people are a little squeamish when you start talking about those kinds of things. How easy is that test, the test that you take home and do the screening?
So the take-home test that we use is actually called a FIT test, a fecal immunochemical test. It's actually easier than the FOBT test that people are used to doing. The FOBT test is 3 samples, and you actually have to collect the sample and put it on a card. With the FIT test that we use, you actually just have to swish a brush around near the stool and collect 2 samples that way. So it kind of reduces the ick factor of it. So it's an easier test to do.
So you swish the brush near the stool?
Near the stool, right. So there's actually no collection of the sample necessary.
Well, that should make it a lot easier for people to do.
Right.
Is it 2 separate days?
2 separate bowel movements. It doesn't matter if it's in the same day.
That's terrific.
Yes.
Now, you do that test. What if somebody comes up and has a screening test that is positive?
Okay. So if it's a positive, FIT take-home test.
FIT take-home.
They would go for a colonoscopy just to rule out that it's not colon cancer. If they have an abnormal test for the breast or cervical, we do all of the follow-up examinations and diagnosis of the condition.
Does your program pay for the colonoscopy?
Yes, we would cover the colonoscopy.
There is no reason for anyone in Brooklyn who needs it not to get a FIT screening test followed by a colonoscopy. Now, what age do you start screening for, let's start with colon cancer, since it's the second leading cause of death in both men and women?
For colon cancer, it should be 50 years and above. Or if they have a family history or a personal history, which would be a family member that had colon cancer or colorectal cancer. And if they have any medical history of Crohn's disease or colitis, which would put them at risk for colon cancer, they could start earlier.
Start earlier than 50?
Yes.
And when do you start screening for breast cancer?
Well, we start usually screening at age 40, unless there is a family history or some other condition or symptom present in the woman. For the clinical breast exam, obviously, that should start at a younger age on a yearly basis.
Now, there are going to be some people out there that says they've heard that you don't have to do the clinical breast exam anymore. What do you say to that?
I say that it's still very important. You want to have the combination of the exam so that if the doctor does feel something, they can recommend a specific test to kind of focus on that one area.
And when do you start cervical cancer screening?
Well, cervical cancer screening in general starts at age 18 or at the age of first sexual activity. Through this program, however, we do focus on women that are 40 and older.
40 and older
Yes.
for cervical. So just to get it all straight,
Yes.
40 and older for cervical, 40 and older for mammogram,
Yes.
and 50 and older for colon cancer unless you have a family history.
Correct.
Same with breast cancer unless you have a family history.
Yes.
Now, what is it that keeps people, we know that an ounce of prevention is worth a pound of cure. Yes. Early detection is your best protection. We know all of that. Everybody can say those words. What keeps people from coming to get screened?
Well, a lot of times we have people that don't come because of the lack of insurance. But thank goodness for programs like these, we take care of that. The program is really focusing for people without insurance. But a lot of other times also it's a fear of finding something or just the lack of interest to go see the doctor for these exams because of the fear or the stigma associated with cancer.
It is interesting that people will put things off. And then when they go to get diagnosed, it's really worse and worse and worse. So one of the things we need to tell them again today is about the fact that getting screened early, especially with colon cancer, can actually prevent the cancer from occurring.
I think fear, again, of the test itself, but finding whatever is there early can really prevent you from all the other challenges that cancer brings with it. So I think we really encourage people to go have their screenings done. If they have no insurance, they could come to our program. If they have insurance, they should go to the doctors and schedule this.
Since about 38% of the people who are living in New York City now were not born here, does it make any difference if you're undocumented?
No, that's the great thing about this program. As long as you have no insurance, you're eligible to receive the services. So there's no need to bring proof of documentation. As long as you're residing or living in New York City, you are eligible, and if you have no insurance.
Even though your program is located at Downstate, you said in New York City. So people can come from any place in New York City to the program?
Absolutely. As long as they're willing to come get the services and any follow-up testing in Brooklyn, they are welcome to come through our doors.
So can you give me an idea of how many people you screened, say last year, or any period you want to tell me?
Okay. Well, since we started this program, which was somewhere around the middle of November, we have seen or registered about 170 people through the program. But we really have money to cover many more screenings than that. So we really encourage the people that need the services to contact us.
Now, do you do any kind of outreach or go to places that people are congregated who may not have insurance? Are you out there looking for them and beating the bushes?
Yes, absolutely. And as well, if anyone knows of an organization or belongs to an organization that would like us to come out and speak with their congregants or their members, we encourage you to contact us and let us know about your organization.
That's exactly what I was hoping that you would say.
Yes.
Come and you will come and talk to them
Exactly.
and give them all this information in case they didn't see it here.
Yes.
Now, we know that we're going to put up your information later about how to get in touch with
Yes.
you. But if there's one phone number that you want to see?
Absolutely. So the general number for the program is 718-567-1384.
Thank you both for being here to talk about this very important program and resource we have here in Brooklyn. Thank you.
Download this program's podcast on iTunes. Keywords Brooklyn Independent Television.